Hello, I'm Dr. Ken Landau. Thanks for watching. Let's talk about Mobic or Meloxicam. This is a non-steroidal anti-inflammatory drug. It's in the same family as Celebrex and ibuprofen and naproxen. It was patented in 1977, FDA approved in 2000, went generic in 2006, closely related to another NSAID known as Feldene or piroxicam. The Mobic is the 38th most commonly prescribed medicine in the United States. More than 19 million prescriptions every year. It's approved for osteoarthritis, rheumatoid arthritis, juvenile rheumatoid arthritis in children over age 2. Comes in tablet form, 7.5 or 15 milligrams. Comes in an oral suspension for the children with juvenile rheumatoid arthritis. Comes 7.5 milligrams in a teaspoon. Now the FDA has approved an intravenous form, supposedly for 24-hour pain relief, but it seems that for the last 6 hours of the 24 hours, it's no different from placebo. Remember, again, take the dose, shortest period of time, lowest dose possible to reduce the likelihood of side effects. You can take it with or without regard to meals. If you have rheumatoid arthritis, osteoarthritis, you start off at 7.5 milligrams, taken one time a day. If you don't get relief after some period of time, can increase it to 15 milligrams. Again, once a day. It's not a divided dose. You don't take some in the morning and some in the evening. You take one dose once a day. If you have juvenile rheumatoid arthritis over age 2, we use the oral suspension, and the dose is related to body weight. Now, even though Celebrex and Meloxicam can be used for acute pain, they seem to be less effective, according to some studies, compared to, say, full doses of the other non-steroidal anti-inflammatories like ibuprofen and the naproxen. Even though it's anti-inflammatory, it does not take the place of prednisone or cortisone. In 2016, the FDA approved strictly for osteoarthritis, not for rheumatoid arthritis, but just for osteoarthritis. They approved a new form. It's a capsule form. It's called Vivlodex. And it comes in 5 and 10 milligram capsules. And the submicron particles in the medicine supposedly are going to be absorbed more rapidly. Whether there's really any difference as far as the effect is concerned from the standard Meloxicam, that's doubtful. There's a generic form available, but that's been approved, but it's not available at the present time. In 2018, the FDA also approved an orally disintegrating Meloxicam tablet. Comes in blister pack, 7.5 milligram, 15 milligram. Again, it's approved for osteoarthritis, rheumatoid arthritis, juvenile rheumatoid arthritis. You open up the blister pack, place it on your tongue, dissolves almost immediately. You don't need any water. Seems to work just as effectively as the standard Meloxicam. An interesting side note is that the drug seems to work to help the levonorgestrel, which is a female hormone that can be used for post-coital contraception. So the morning after pill. Well, if you take the levonorgestrel in combination with the Meloxicam, it seems to work better than the levonorgestrel by itself. Seems that the Meloxicam might alter some of the metabolism inside cancer cells. The drug is commonly used in the Army. It's in the wound medication pack for mild pain. You could take it or acetaminophen. Those two are both provided. Don't take the drug if you have known hypersensitivity to it. Don't take it if you have asthma, especially if you have what's known as the aspirin triad. We have asthma and allergic rhinitis and nasal polyposis. If you do take the drug, can cause severe, even fatal bronchoconstriction, narrowing of the wind passageways. Obviously, something to be avoided. The bioavailability, it's pretty good. If you take it with a high-fat meal, it's going to increase the plasma concentration by about 20%, but that's not enough to warrant taking it with food specifically, so you can take it with or without food. It's not reduced in concentration if you happen to take some antacids. It's important that there's a liver enzyme known as 2C9, and it's very important in the metabolism of these kind of drugs, including Meloxicam, of course, it metabolizes the Meloxicam to 4 inactive ingredients, 4 metabolites, that are then excreted in the urine and the stool. If you happen to have inadequate quantities of the 2C9, then the Meloxicam can build up in the system. Another interesting side note is it can be used for veterinary use, approved for dogs and horses and cattle. Question about cats goes back and forth. Originally was okay for cats, then it wasn't okay for cats, then cats for 1 dose only around the time of a procedure, then okay for cats in general. Well, when we talk about the non-steroidal anti-inflammatory drugs, we talk about 2 different groups. We talk about the non-specific COX inhibitors, non-specific non-steroidal anti-inflammatory drugs. They inhibit both the COX-1 and the COX-2. Well, the COX-1 is important to keep the intestines working right, keep the kidneys working right, keep the blood clotting appropriate. So we'd rather leave the COX-1 enzyme alone. Now, the Mobic, or the Meloxicam, is a non-specific non-steroidal anti-inflammatory drug. But at the standard doses, it, just like with Celebrex, works principally on the COX-2. That's the one associated with the inflammation. That's the one we would like to get rid of. Well, it comes with a black box warning. The black box warning suggests that you could increase your risk of cardiovascular problems or GI problems if you take the drug. Same thing with basically any of the NSAIDs, non-steroidal anti-inflammatory drugs. Can increase the risk of heart attack and stroke, can be fatal. Certainly the longer you take the drug, the higher the dose, the greater the risk. And if you happen to have other cardiovascular risk factors, then that increases the risk still further. Should not take the drug right around the time within 10 to 14 days after bypass surgery, heart bypass surgery, or the CABG surgery, CABG. Well, how long should you wait? People argue about that. They still find the risk is significantly elevated after a year, goes down to pretty much normal after 3 or 4 years. The black box warning also says that if you take the drug, you might increase your risk of gastrointestinal bleeding or ulceration or perforation, either of the esophagus or the stomach or the small intestine or the large intestine, can be fatal, can come on without any kind of warning. Increased risk for elderly individuals, can be a little bit toxic to the liver. About 1% of the people who take the drug are going to have significant elevation of the liver function test, and about 15% going to have more mild elevation of the liver function test. Can either cause new onset hypertension, or if you already have hypertension and you're taking medicine, might worsen control. Seems to interfere with the effectiveness of ACE inhibitors and angiotensin receptor blockers and the thiazide diuretics. Can cause fluid retention, and if you happen to have a history of heart failure, can cause the heart failure to decompensate. The COX enzymes are very important as far as the renal perfusion is concerned. So the blood gets to the kidney by the grace of the COX enzymes, so the prostaglandins that are necessary to get the blood to the kidney. Well, if you happen to take the drugs, then you might decrease the blood flow to the kidney. And that's especially important in elderly individuals and people who have impaired renal function, in people who have heart failure, people who have liver disease, people who are dehydrated, have vomiting or diarrhea, people who are taking the ACE inhibitors or those ARBs. Well, that's why you shouldn't take these drugs if you have severe renal impairment. If you're taking the drug and all of a sudden you start to develop a skin rash and you don't know what the skin rash is, stop the drug and see what happens. Notify your physician, because in some very small percentage of individuals, the rash may progress to a potentially life-threatening eruption known as either erythema multiforme, Stevens-Johnson syndrome, exfoliative dermatitis, toxic epidermal necrolysis. Take it from me, you don't want any of those kind of diseases. Well, additionally, if you're dehydrated, if you've been taking high doses of a diuretic, if you've had nausea or vomiting, or you're elderly, you're bedridden, you're not taking enough fluid in, you should make sure you're rehydrated before you even start taking the medicines in the first place. If we look at the side effects, the standard kind of side effects tend to be relatively mild. Same thing in adults and pediatric population, abdominal pain and some diarrhea, sometimes some indigestion or some edema. Well, the drug also works to cut down not only the inflammation, but it's painkiller, of course, and it brings the temperature down. So if you're taking the drug for osteoarthritis or rheumatoid arthritis and you get some other kind of condition additionally, in addition to your osteoarthritis and rheumatoid arthritis, maybe the drug's going to delay the recognition of the symptoms of that new disorder because it's going to keep everything relatively under control. That could be harmful. Well, if you take the drug, you could develop an anemia. And the anemia could be because you're retaining fluid, and that's just a situation with dilution. Or it might irritate the intestinal lining a little bit, and then you could develop what's known as occult bleeding. And the occult bleeding, you don't even know. Your stool looks the same. You're not vomiting blood. But some people develop gross GI bleeding, and the gross GI bleeding can come as very dark or black, tarry stools. In some people, less commonly, as bright red blood that you pass. Sometimes it can cause a decrease in the production of a chemical that's important in manufacturing red blood cells, erythropoietin, and it can decrease that. Well, that means that if you're taking the drug, especially if you have a history of anemia, you ought to check every once in a while to make sure that you're not losing blood. All of these drugs might cause some people to have problems with the coagulation system. Now, it's not anything like aspirin, but if you have a coagulation disorder and if you happen to be taking a medicine, for instance, you're taking the warfarin that increases the bleeding, or you're taking aspirin that increases bleeding, you might have some problems. So too with potentially the selective serotonin reuptake inhibitors and SNRIs. Have to be careful if you're taking lithium for bipolar disorder. The lithium concentration is going to increase by about 20%. That might be into the toxic level for some people. And the liquid form, the suspension form, has a certain kind of a chemical, sorbitol. And sorbitol, if you happen to be taking a drug to reduce your potassium level, that can cause intestinal necrosis. So part of the intestine can actually die. So that obviously is serious. Do be careful. Well, if you happen to be taking methotrexate, if you happen to be taking cyclosporin, both of those drugs with the meloxicam can increase the likelihood of kidney disease. Doesn't seem to have too much to do with taking Lasix, doesn't change the digoxin concentration, doesn't change the cimetidine. But if you're taking a drug known as cholestyramine, typically used to reduce the cholesterol, typically used for certain other kind of disorders with bile acid abnormalities. Well, that increases the clearance of meloxicam by about 50%. So it decreases the amount of meloxicam in the system quite substantially. And it decreases the half-life of the drug from about 19 hours to about 12 hours. Well, if you're a pregnant woman, you should not take the drug after 30 weeks of gestation. It can hurt the unborn child. It can cause the connection between the pulmonary artery and the aorta to potentially close. And if that happens, that stresses the heart. Taking the drug during other time in the pregnancy, first trimester, second trimester, well, it doesn't seem to cause any kind of significant problem, at least in pregnant rats, but in rabbits, it increases the likelihood of what we call a septal defect, a hole in the heart between the right side of the heart and the left side of the heart. Shouldn't take it during labor and delivery, shouldn't take it during lactation. If you're a child, it is approved for those individuals with juvenile rheumatoid arthritis over age 2. Older populations start with the lower end of the dosage form. Liver disorder, mentioned before. So if you happen to take the drug and now you develop jaundice or a type of hepatitis or you're feeling poorly, one of the things you have to check is liver function. Kidneys, well, you don't have to worry about mild to moderate kidney disease could probably take the drug, not if you have severe renal disease. It seems that people who have severe renal disease, the free fraction of meloxicam can increase quite substantially, and it's that free form of a drug, whatever the drug is, that tends to get people in trouble. Well, if you happen to be on hemodialysis, you could still take the drug, but at a dose no higher than 7.5 milligrams a day. It's not mutagenic, it's not carcinogenic. It might cause a temporary problem with fertility. It seems those prostaglandins are also important in the ovary releasing the follicle. So then in women who are having difficult time conceiving, well, probably a good idea to stop the medicine periodically. If you're taking the medicine, especially for a long period of time, ought to check some of the blood chemistries, check to make sure you're not becoming anemic. If you overdose on the medicine, well, lethargy and drowsiness and nausea and vomiting, epigastric pain are all relatively common. Less so gastrointestinal bleeding or hypertension or renal failure, hepatic dysfunction, respiratory problems. Some people can go on to develop coma and convulsions and cardiac arrest, but the overwhelming majority of people who overdose, especially if it's relatively mild overdose, they all survive. And we have that cholestyramine I mentioned a while ago. Well, that can accelerate the clearance of the meloxicam from the body. And if you happen to have a person who overdosed, and it's within 1 to 2 hours after the overdose, then activated charcoal will help prevent the absorption. Well, the drug works because it's anti-inflammatory, it brings the temperature down, and it's analgesic, it treats the pain. It does all of that by working on the COX enzyme. And it works principally on the COX-2 enzyme at the standard lower dose. It's less selective for the COX-2 enzyme at a higher dose. The absolute bioavailability of the medicine, somewhere around 90%, seems to get to the peak concentration in the system after about 4 to 5 hours if you take it fasting. But interestingly, because it works on the biliary system, it seems that there's a second peak. And the second peak occurs after about 12 to 14 hours. After you've been taking the medicine for about 5 days, then you get to a steady state that's higher than if you just took one pill. The half-life of the medicine, somewhere between about 15 hours and 20 hours. In the pediatric population, interestingly, there's less exposure to the medicine if the child is between the age of 2 to 6 than if the child is between the ages of 7 and 16. Now, if you happen to want to take it with a high-fat meal, it's going to increase the peak amount in the system by about 20%. But if we look overall at the amount of the drug in the system for a 24-hour time period, it doesn't seem to make any difference, whether it's with food or without food. And as I mentioned, no change with antacids, the amount that's bound, somewhere in excess of 99%. It seems that if we look inside the synovial fluid, inside the joint, you're taking it obviously because you have rheumatoid arthritis or osteoarthritis, well, it seems that the free fraction in the synovial fluid is about 2.5 times greater than it is in the plasma. And the reason is, in the plasma, it seems that the drug is bound to albumin. In the synovial fluid, there isn't much albumin around. It's extensively metabolized in the liver to the inactive metabolites. They go out in the urine and the feces. If we look at the geriatric population, the overall concentration, the steady state concentration, same as it is in younger individuals, except if a person is a woman over age 65, then there's going to be about a 50% increase in the amount in the system over a 24-hour time period, and the peak maximum concentration is going to be about 30% more than it is in a woman who is less than age 55. Well, clinically, how does the drug work? Clinically, it works okay. It's got significant benefit at 7.5 milligrams, 15 milligrams if we look at osteoarthritis, if we compare it to placebo. On the other hand, if we compare it to an active drug like the Meloxicam or the diclofenac, which is the same thing as Voltaren, seems that the drugs pretty much are equal. If we look at rheumatoid arthritis, a 20% reduction in the severity of rheumatoid arthritis, well, 7.5 and 15 milligrams seem to be pretty much equivalent. If we look at 22.5 milligrams, you don't get any added benefit. Interestingly, in juvenile rheumatoid arthritis, well, there's a question about whether there's any difference between just naproxen and the meloxicam. Now, interestingly, there is a study underway combining the triptan, that's like Imitrex, that's for migraine headache. Well, in the same pill, put the triptan and the meloxicam in. Well, the 2-hour freedom from pain is about 20% if you take the drug versus about 7% if you take an inactive drug. Doesn't seem to be all that promising if you ask me. Now, the COX enzyme is very important as far as kidney function and protection of the gastrointestinal mucosa and the regulation of the aggregation is concerned. And it seems that if we can be more specific and inhibit the COX-2, we might be able to get rid of some of the side effects, that's the theory, with the non-specific NSAIDs, the kind that block both the COX-1 and the COX-2. On the other hand, if you take a COX-2 inhibitor and you compare it to, say, the ibuprofen or the naproxen, and you combine the ibuprofen and the naproxen with just a standard proton pump inhibitor, a drug like omeprazole or Nexium, then you get basically the same kind of benefit without any extra added risk. Well, just remember that even though we talk about these drugs in such glowing terms, in 2004, Vioxx, which was one of the most widely prescribed medicines, it was a COX-2 inhibitor. It was supposedly safe. Well, the company did a study, and they actually found that it increased the risk of cardiovascular complications. So these drugs do need to be treated with a certain amount of respect. And then we talk about the gastrointestinal problems. Well, if you take the drug at a standard dose without any kind of warning, you're going to develop significant complications after about 3 to 6 months in 1% of the population. About 1 year, it's going to be about 2 to 4%. And if you happen to have other kind of conditions, say you have a history of gastrointestinal bleeding or peptic ulcer disease, you're going to increase your risk about 10-fold. If you take aspirin with it, any of the other non-steroidal anti-inflammatory drugs, going to increase your risk significantly. So don't forget, the longer you take the drug, the higher the dose, the more the complication. And if you happen to smoke cigarettes, if you happen to drink alcohol, if you happen to be older, if you happen to have poor general health, well, that's all going to increase your risk. So again, shortest period of time, lowest dose, best thing that you can do. The coronary bypass surgery, well, we know that any of these non-steroidal anti-inflammatory drugs, if you take them, say, 10 to 14 days after the bypass surgery, going to increase the risk of stroke, increase the risk of heart attack. That's any of the drugs in the family. And we know that you're going to increase your risk of complications if you happen to be taking the Meloxicam or the Mobic with aspirin or with any of the other non-steroidal anti-inflammatory drugs. Those are going to all significantly increase the risk of gastrointestinal bleeding. So you do have to be careful. One study showed that if we're talking about the heart, well, you're going to increase the risk by about 3-fold if you take Meloxicam, 5-fold if you take the Celebrex, 10-fold if you take the naproxen, and 12-fold if you take a relative of ibuprofen. And as far as gastrointestinal bleeding is concerned, increase the risk, according to some studies, 3-fold about if you take the Meloxicam or the Celebrex. If you take it with naproxen, it might increase the risk of GI bleeding by about 6-fold. So, again, be careful, be careful, be careful taking these kind of drugs. And if you're going to have some kind of surgery it's probably a good idea to stop the drug for a short period of time prior to the surgery, especially if you're undergoing some dental surgery. Seems that if you're taking the drug at the time of dental surgery, it might lead to some abnormalities in the taste, some ulcerative stomatitis, even lead to a dry socket. Now, according to Consumer Reports, there's no evidence that any of these drugs are demonstrably better than any of the other non-steroidal anti-inflammatory drugs. So whichever one you take, you have to realize they all have some risks, and the risks are all basically the same, some a little more, some a little less. Well, if you want to take the Meloxicam, how much is it going to cost? Well, if you go now to a standard store, standard pharmacy, a month's supply of the 7.5 milligram pill is only going to cost you somewhere between $11 and $30 cash. If you have a coupon, and you have a coupon, say, from GoodRx, you could get it for as low as $4.50 up to $11. But if you go to either Walgreens or to CVS, it's going to be more than $20. If you want the brand name drug, if you want the Mobic, that's exactly the same, basically, as the Meloxicam generic, well, the cash price is going to be over $330, and the coupon price is going to be about $280. So that's the story about Mobic. It's a non-steroidal anti-inflammatory. It's actually a non-specific NSAID inhibitor, inhibit the COX-1 and the COX-2, but at low dose, at the standard kind of dose we use, it acts to inhibit the COX-2, not the COX-1. And that's one of the reasons why it's extremely popular. It's mostly for osteoarthritis and rheumatoid arthritis, juvenile rheumatoid arthritis. Whether you take the drug for common ordinary pain, probably not the best idea. And there's some evidence that it doesn't work nearly as well as the standard non-steroidals if you happen to have the acute kind of pain. Anyway, thanks for watching. If you enjoyed the show, please tell a friend. Consider subscribing so that you'll be notified as we post new shows. Appreciate your interest. I'm Dr. Ken Landau.